Welcome to the MediByte channel. As a healthcare professional from MediByte, I'm here to explain a super common late pregnancy symptom in a complete, detailed, and really easy to understand way. Today's explainer dives into why swelling happens and exactly how to tell what's totally normal from what is a serious red flag. Let's get right into it.
Here's our roadmap for today. We're going to cover the normal physiology of fluid retention, how to spot serious complications and warning signs, what to expect during a doctor's evaluation, and finally, how to find safe relief at home.
Is this swelling normal? Listen, it is probably the most common anxiety-inducing question expecting mothers have when their favorite shoes suddenly just stop fitting. It's frustrating, right? So let's validate that discomfort and get you some clear medical answers.
Section 1. Why do we swell? Let's uncover the actual physiological reasons behind this symptom. The medical term you'll hear for this is edema. Simply put, it's just fluid accumulating in your tissues. Now, during pregnancy, a certain amount of this fluid buildup is entirely normal, especially as you hit that third trimester. You'll usually notice it making your feet, ankles, and lower legs look pretty puffy. Occasionally, even your fingers might feel a little tight. But why does this actually happen in the first place? Well, part of the answer lies in your hormones. Right now, your adrenal glands are basically working overtime. They're producing much higher levels of hormones like aldosterone and cortisol. And what do these do? They specifically signal your body to hold on to more fluid. It's a completely natural physiological change designed to support your pregnancy, but it definitely leaves you carrying around some extra water weight. The second main reason for this swelling comes down to pure anatomy and gravity. As your baby grows, your enlarging uterus physically presses down on the large veins in your pelvis. This extra pressure literally interferes with the normal blood flow that's trying to return from your legs back up to your heart. Because the blood is kind of backing up in those leg veins, fluid naturally seeps out into the surrounding tissues, giving you that noticeable puffiness.
Section 2. When swelling is normal.
The absolute crucial point here is distinguishing your run-of-the-mill normal swelling from something dangerous. Normal physiological edema usually affects both legs symmetrically. It's painless, maybe slightly uncomfortable, sure, and leaving you with puffy ankles or feet. Now compare that to a serious issue like deep vein thrombosis or DVT. That typically strikes just one leg. That single leg is going to feel painful or tender, and the skin might even be warm and red to the touch. It's a very stark difference.
Section 3. Understanding serious complications. Let's look at what can masquerade as normal swelling. How do doctors tell the difference? They look for very specific features to rule out serious underlying disorders. First up is preeclampsia, a condition totally unique to pregnancy. With this, you'd typically see a blood pressure of 140/90 or higher, swelling up in your face or hands, and sometimes severe headaches. Doctors check for this using blood pressure readings and urine protein levels. Next is that deep vein thrombosis we just mentioned, a blood clot in one leg, making it swollen, painful, and red. They'll evaluate that using an ultrasound. And finally, there's peripartum cardiomyopathy. This is a rare but serious heart failure condition late in pregnancy. It's marked by swelling in both legs, but it's accompanied by shortness of breath and extreme fatigue. Let's build on that and talk about high-risk factors, starting with preeclampsia. If it gets severe, preeclampsia can actually damage organs like your brain, kidneys, or liver, and it can cause problems for the baby. So it is absolutely crucial to recognize if you are high risk. This includes having had preeclampsia in a previous pregnancy, carrying multiples, having high blood pressure before you got pregnant, or dealing with pre-existing conditions like diabetes, kidney disorders, or autoimmune diseases. Meanwhile, the risk for deep vein thrombosis, where those blood clots form in deep veins, has its own set of triggers. During pregnancy, your body actually naturally produces more clotting factors to prevent bleeding during childbirth. Pretty smart, right? But your risk skyrockets if you have a history of DVT, inherited blood clotting disorders, cigarette smoking, obesity, or if you're dealing with prolonged immobility like being on bed rest. This is highly serious because a blood clot can actually break loose, travel up to the lungs, and cause a life-threatening pulmonary embolism. Section 4. Warning signs to watch. Okay, we've reached the most critical part of this explainer. I want to equip you with the absolute red flags that mean you need to seek medical attention immediately. If you experience a sudden increase in swelling anywhere on your body, or moderate to severe swelling in your hands, like if your rings are suddenly stuck, you need to act. Watch out for swelling in just one leg that feels warm or tender. Other life-threatening warning signs: a blood pressure reading of 140/90 or higher, severe persistent headaches, vision changes, upper abdominal pain,
confusion, chest pain, or difficulty breathing. If you hit any of these warning signs, you must go to the hospital right away.
Section 5. How doctors evaluate swelling. Let's demystify what happens at the clinic.
So you go in to get checked out. What actually happens? Your doctor will systematically evaluate you, usually following a few steps. First, they're going to ask about your symptom timeline. When did the swelling start? Does resting make it better? They'll review your history for those DVT or preeclampsia risk factors we talked about. Next, during the physical exam, they'll check your blood pressure, listen to your heart and lungs, and maybe even check your reflexes or look into your eyes with a specialized light. Finally, they'll closely examine the swollen areas, specifically checking for any redness, warmth, or tenderness. Depending on what they find, they might order specific tests just to be absolutely certain. This could be a urine test to check for high protein levels, or a complete blood count and kidney function tests for preeclampsia. If they suspect a blood clot, they're going to do a Doppler ultrasound of your leg to actually visualize any blockages in your veins. And if they suspect a heart issue, they'll order an EKG or echocardiogram to check how your heart is functioning.
Section 6. Finding relief at home. Now, if your doctor checks you out and confirms your swelling is just normal physiological edema, which, by the way, is the case for most pregnancies, there are highly effective ways to manage it right at home. First, try lying on your left side. This physically moves your heavy uterus off the inferior vena cava, which is that large vein returning blood to your heart. Second, rest frequently and keep your legs elevated above your heart level so gravity can help drain that fluid. Third, look into elastic support stockings. And finally, swap out any tight clothes for loose clothing. You definitely want to avoid socks or stockings with tight bands around the ankles or calves because those literally just restrict your blood flow even further. Swelling is a message. Are you listening to what your body is trying to tell you? As we wrap up this explainer, I want to leave you with that thought. Always pay attention to the subtle differences between the normal, expected discomfort of pregnancy and a true, critical red flag. Your body is doing something absolutely amazing right now, but it occasionally needs you to tune in and take proper action. Thank you so much for watching. I really hope this explainer brought you some clarity and a solid understanding of how to interpret your body's signals during late pregnancy. Please be sure to like, share, and subscribe to the MediByte channel so we can continue empowering you with clear, structured medical explainers. Take care of yourself, and we'll see you next time.